Part 4 of this presentation describes the logical data structures that support the planning and delivery of therapy programs in both the subacute and community settings. The logical data structures that support the planning and delivery of therapy programs in both the subacute and community settings are shaded in mauve in this diagram. These data objects will be described in the next few slides. But before we get into that discussion, let's briefly summarise the stroke care objectives of the three major phases of a normal stroke recovery journey: the acute care phase, the subacute care phase, and the community care phase. As a stroke survivor moves slowly along his or her stroke recovery journey, acute care clinicians need to determine what brain structures and brain functions have been affected by one or more ischemias or hemorrhages, and what medications or medical procedures are needed to stabilise the survivor's medical condition and reduce the likelihood of further brain damage and stroke episodes. Once the stroke survivor is transferred to a subacute setting, specialist stroke rehab therapists need to assess what actual physical, mental, cognitive and emotional disabilities have been caused by those stroke events, and plan and implement therapy programs that target the disabilities that need to be overcome before the stroke survivor can be safely discharged from hospital and back into their community. And when the stroke survivor is discharged back into their community setting, community-based clinicians and therapists need to plan and implement therapy programs that target disabilities that need to be overcome in order to return the stroke survivor's quality of life to an acceptable level. The Stroke Rehab app can assist in the acute, subacute and community phases of the overall stroke recovery journey in a number of ways. It can assist in the assessment of a stroke survivor's disabilities by first defining stroke event disability objects, which match each significant disability with the stroke event that caused it. This relationship can be expressed in the following way. A stroke event may affect many abilities or emotions, and an ability or emotion may be affected by many stroke events. And second, by defining disability linkage objects that recognise that emotional disabilities may be indirectly caused by stroke-related physical, mental, cognitive and communication disabilities. This relationship can be expressed in the following way. A stroke event disability may cause many stroke event disabilities, and a stroke event disability may be caused by many stroke event disabilities. And third, by recognising the need to prioritise stroke event disabilities so that the disabilities that impact most on a survivor's capacity to live safely in the community or to experience an acceptable quality of life can be addressed as soon as possible. This is important because there is not necessarily a direct correlation between the severity of a disability and its impact on a survivor's quality of life. So therapists must be aware of which disabilities are causing the greatest impact on a stroke survivor's safety in the community and quality of life, and that this perception may change over time as the stroke survivor travels along his or her stroke recovery journey. The Stroke Rehab app can also assist the overall stroke rehabilitation process by helping clinicians and therapists to select appropriate therapies and to plan their delivery. Because, as we saw earlier, the central database contains therapy target objects, which, hopefully, represent up-to-date, evidence-based clinical best practice, and which clinicians and community-based therapists can access to receive expert guidance in the selection of therapies that most effectively treat specific physical, mental, cognitive, or emotional disabilities. This knowledge is expressed in the following relationship. A therapy program may target many abilities or emotions, and an ability or emotion may be targeted by many therapy programs. The central database also contains stroke event functional maps